Everyone, welcome to McGill Cares, a weekly webcast series to support family and informal caregivers about a wide variety of topics. I'm Claire Webster, a certified Alzheimer care consultant, a former caregiver, and founder of the McGill Dementia Education Program. Today, I'm very excited to introduce my guest, Dr. David Eidelman. It is because of him that we are bringing you McGill Cares. It is because of him that I was able to found the McGill Dementia Education Program. I was literally an ordinary citizen who met with Dr. Eidelman on February 2nd, 2017, with an idea of wanting to change the healthcare system and educate family caregivers and medical students at McGill University. And he welcomed me in his office. So the topic today will be how the pandemic is changing the way we teach students and provide care. Dr. David Eidelman is Vice Principal, Health Affairs, and Dean of the Faculty of Medicine at McGill University. A respirologist and clinician scientist, Dr. Eidelman previously served as chair of McGill's Department of Medicine and physician-in-chief of the McGill University Health Center. During this webinar, Dr. Eidelman will answer questions about how the pandemic has impacted medicine and all the health professions and sciences represented in the faculty, and its influence on the way our teachers will teach and our students will learn in the future. Welcome to the show.
Thank you very much.
So I guess my first question is, being a non-McGill alumni, being just this ordinary citizen, what made you believe in the idea of giving me a chance to develop my program?
Well, I think the first thing is it's a very important area. We have population demographics. People are living longer. We have more and more people who need the kind of services that you talked about. But to be honest, you wanted to do something great, and you came with a very, very compelling story and a very compelling personality. And I didn't see that it was really a hard decision to make. You had something that you wanted to bring to the community that the community needed. And I think one of McGill's roles, any university's roles, is to take its place in terms of social responsibility. Of course, the first job of a university is education, research, creating new knowledge. But we also, especially a publicly funded university, have a responsibility to society at large. And in a faculty like ours, which is about training people to be the next generation of caregivers, it's critical that we also look out to the rest of the world to see what the needs are. And you came to us with a real need that is unfulfilled in the community, and we saw an opportunity to help. So it was an easy decision.
Well, what's truly amazing is, from a personal basis, you've really empowered me as a human being, coming from such a difficult and challenging journey as a caregiver and not receiving any support from the healthcare system from my experience. And, so you've really empowered me. But most importantly, since we've officially launched the program, which was in September of 2017, we have now touched the lives of probably close to 2,000 family caregivers between the in-class workshops that we've done, the online education, the webinars. It's truly amazing just because of that saying yes. And so, and I'm looking forward to the future and how many more people's lives are going to be touched, by the university's willingness. And not only did you give me the opportunity, but you assigned some of McGill's best. Right. You gave me Dr. Serge Gauthier, Dr. Morin.
Well, so I wanted to make sure I didn't forget to thank the members of my team. So, of course, those two. There are also people in my office that you work with who really have to say get a lot of credit because they believe very much in this project, and they pushed it along, made sure that we stayed focused on it. People like Dimitri Kafantaris, more recently Liam Moss, and others who Diana Colby. There's a whole raft of people, the people at the Simulation Center, including Dan Widener and others who have all worked on this. Without that team, I wouldn't accomplish much. So I really have to make a point of thanking them. I'm sure I left out somebody important. And so for whoever I left out, I apologize. But it's a big team, and it is the secret of our success.
So, along the same lines, so what is McGill's commitment in general to patient-centered care and community outreach? In addition to our program, is this something that the university is looking towards doing more of?
Well, for sure, the university, but especially our faculty, this is at the core of what we do. It's the reason for our existence, whether it's training the next generation of health professionals or even our research programs. They're all oriented around trying to meet the needs of society in general and patients in particular. As you know, our faculty has a School of Medicine, the medical school, but we also have nursing, physical and occupational therapy, communication sciences and disorders. We have a public population of global health and biomedical sciences. So all these different schools have at their center trying to really contribute to society and make the world a better place. In terms of our programs, all of our programs emphasize the centrality of the person that we're looking after, whether it's in rehabilitation or a patient with a medical student or a resident in training. This is very much at the core of what we do.
So prior to COVID, we were teaching in-class workshops to family caregivers at the McGill Steinberg Center for Simulation and Interactive Learning. Prior to becoming involved with McGill, I had never heard of this facility. I kind of describe it as an underground hospital for medical students, all the mannequins, the operating rooms, the actors. Can you please explain the important role that this facility and simulation plays within the Faculty of Medicine?
So we're very fortunate to have one of the world's best facilities of this type, and it's named after the Steinbergs because of a generous gift by the late Arnold Steinberg and his wife. And that gift has allowed us to really, we have the largest simulation center of its type in Canada. As you can imagine, in the old days when I learned to be a doctor, mostly what I got to do was practice on people. So they said, oh, here's how you do something, go try it on Mrs. Smith. And poor Mrs. Smith was a victim. But sometime in the 1990s, we started to take on some of the lessons of the airline industry and other industries where things are, you get to practice in a safe way before you actually practice on people. And that was the origin of simulation centers, and they're now pretty much standard in all health professions around the world. Whenever you go, you'll see simulation centers. Ours is particularly strong because, first of all, it was one of the first ones, but it's also very, very extensive in terms of its capacity, what it can do. And I know you mentioned the actors. I actually think the coolest thing in the simulation center are the actors. Even though they have these amazing tools and gizmos, like you can simulate an operation or working in the intensive care unit, and these are amazing. The experiences I've had there that are the most impressive are the ones where I've been in a room with an actor who has simulated a patient in distress or a family member who is undergoing a difficult time or someone who's received bad news, and watched either, usually luckily as a professor, I don't have to be the victim, watch a student or a resident struggle to try and address this. But you can imagine how much better you are if you get to practice this in a controlled environment rather than learning how to do with it with a real person who is undergoing a very stressful phenomenon. So at this point, simulation centers are absolutely critical to learning. And as you can imagine, that's going to become even more important as we go along.
Yeah, I mean, just to set the stage for people who are listening, with regards to our program for the dementia education, what happens is at the Sim Center, they have this full-scale apartment with a kitchen, bedroom, bathroom, living room, dining room. And what we do is we bring the family caregivers behind a viewing wall, and we have an actress who portrays what it's like to have dementia, and the second actress plays her daughter, who comes and witnesses all the different dangers that her mother could be going through living alone. So that's where we teach all the safety components of our program, and it's just it's remarkable what we can do. And then that whole interaction between the family caregivers and actually physically being there and seeing. So I look forward to returning to the Sim Center once this pandemic is over.
We're working hard right now to try and reopen the Sim Center, and we're going to really need it in the future. But it is really critical, and you've had that experience. You can see how much better it is to learn something like that rather than just listening to a lecture or reading a book. Actually, physically experience it. it's a very profound learning experience.
It certainly is. So I want to start talking about this unprecedented situation that we're currently in with regards to the pandemic. So can you tell us, what is your perspective on the pandemic crisis and how has it impacted health education and sciences?
Well, there's no question that this pandemic is really unprecedented, devastating, and really scary kind of phenomenon. I mean, before we went on, I was saying that I haven't ventured out of my neighborhood in months. I've been doing everything remotely, and the impact of this has been really remarkable around the world. It's hard to imagine the total impact. First and foremost, in terms of the people who've gotten the infection and who were sick, and those who died, but of course their families, not to mention the economic impact, the social dislocation, the disruptions of societies. We see a lot of unrest. I mean, this is a very, very big issue. It's not the first time, though, we've had a pandemic. I mean, there have been ones in the past. And in some ways, we're actually better equipped now to deal with this than we've ever been. Whether it's socially, you notice that unlike in the 1930s, where the economy fell down, the government actually cut spending. Here, the government increased spending, and that's going to protect some people from some of the bad consequences. We'll have to pay for it eventually, but at least for now, people aren't in breadlines. Okay, so that makes a difference. We saw that we don't have a cure for COVID-19, but there's been a lot of progress in understanding how to manage the cases and to do a better job of that. But there are places where we fell down. I don't have to tell you, in terms of long-term care, the care of the elderly, and particularly care of patients with dementia. I think we did, in this province at least, we did a terrible job. Okay, I don't think we're the only place that did a terrible job, but I live here, so I'm not very happy with how we did, and I think we can do better. Here in McGill, we have fantastic people, brilliant people who are working on various aspects of trying to, first of all, make sure that we respond as well as possible to this crisis, and to also think about how we can do better in the future. And certainly, I hope that we've had the first wave more or less in this province. I'm hoping that if there is a second wave, we'll be able to deal with it even more effectively than we did before. One area where we have to do better is certainly in looking after people with dementia, people in chronic care, and so on. That we can't allow a repeat of that. I have to say, it's been really remarkable to see how the people I work with, my team, people around us, have really risen to the occasion. This has been, as I said before, it's unprecedented. And as in many walks of life, people have really turned on a dime, changed the way they work. People who never miss the day of work are now living, working at home for weeks and weeks. We've developed, we're learning how to use new technologies. People have developed all kinds of clever ideas of how to manage, mitigate some of the effects of the virus. People are working on different aspects of finding solutions. It's a bit tougher when it comes to the education side. As you can imagine, because of this big crisis, we've had to stop certain kinds of educational experiences, as all the schools were closed and so on. But this is a big issue if you're a young person learning to be a nurse or a doctor, and you can't see patients. You can't finish your course, right? You can't learn to be a nurse by correspondence school. So this is a big challenge for us, and we're working hard now to reopen our clinical experiences. And fortunately, because the big first wave has passed, we're going to be able to do that. But we can't work as business as usual. We can't have the same number of learners in a clinic or on the wards. The other area is our residents, the people, the doctors who have finished medical school but are still training. They've had a big disruption, some of them, in their training because either their specialty was closed or they've been redeployed to look after COVID-19 patients during the big surge. And so this is a big issue. So from an education point of view, we have some catch up to do. And of course, we have a lot of challenges to plan next year. How are we going to be able to deliver education when we can't have, we have classes usually with 200 people in them, right? Well, while COVID-19 is around, no one's going to allow us to have a class with 200 people in a room. We're going to have to do that by Zoom, the way we're doing things now. That calls for different teaching strategy, thinking about things differently. There's some advantages and there's some disadvantages, but I actually have to say that although COVID-19 has had a big impact on healthcare and on research, it's particularly had an impact on education. And on the research side, we had to stop all our research except for COVID-19 research, and we're only now starting again. And also, like with education, we don't know how, it's like restaurants. Restaurants are going to open, but you're not going to allow people to sit as crowded as they did before. And the waiter is going to be wearing a mask and all of that sort of stuff.
Yeah.
It's a little bit like that in the research world, where people are used to working a certain way. We're going to have to think differently and work differently. Fortunately, I happen to work in an organization, McGill University, with lots of really smart people who have really good ideas. So I'm sure they're going to figure it out.
So I have like a kind of like a two-part question. So prior to COVID, were medical students trained on how to handle a pandemic of this proportion? And then how will the pandemic change the way students are educated at McGill in terms of handling future virus outbreaks of this nature?
So prior to the pandemic, first of all, everybody heard of pandemics, and it gets taught when you're learning about infections. It's like, they look back to 1918, 1917, 1918. There was the so-called Spanish flu, which wasn't particularly Spanish. The Spanish flu, and everybody reads about it and goes, "Wow, that must have been terrible." But now they're going to be reading about COVID-19 instead. The way we organize education is very much assuming the world is a certain way. And until March or maybe February of this year, it was that way. And so we didn't emphasize what happens in a pandemic. We didn't really think about a lot of these things. And so that's a big issue. It's a bit like there's an area of in business, supply chains. To be efficient, people organize supply chains to be really efficient so you don't have any duplication and everything moves smoothly. And we've seen what happened. A lot of these supply chains started in China, and when China was offline, we had a big problem. Education is not like that, but we got very good at teaching people to prepare for a certain kind of system. And it was really efficient for that. But now that the system's changed, we have to do a lot of work to rethink about the way we go about teaching so that it's adapted to our current reality. And I also hope that we'll come up with ways of making our graduates more resilient. So as the world brings different kinds of challenges, our graduates, who've always been extremely good at responding to issues, will continue to be that way and will emerge as leaders. And for example, next week our graduates are graduating.
How are they graduating? My
we're
daughter.
Having an online convocation. It's not the same thing as.
How is that going to? I mean, my daughter too is part of the class of 2020, graduating from high school, and it's just been very challenging. So how is McGill celebrating?
So we are going to have an online ceremony. All the deans there'll be talks. There'll be some prestige speakers and so on. We're hoping that next year we'll be able to invite graduates back for a real ceremony. One of the highlights of being the dean is that I get to shake hands with every graduate who shows up at graduation, literally, and personally wish them congratulations. And it's not going to happen this year. It's just a sign of the many changes that are going on. And I know everybody who's listening has to deal with. It's stressful. It's tough, but I think we'll get through it.
What is McGill's role now from a global scale in terms of finding a cure for COVID? And has the urgency? Because I've listened to other talks. When McGill checks in with the Wednesday Weekly with Derek, and listening to some researchers talk about how the urgency has put aside research in other areas. So what is McGill's role?
Well, McGill is a leading research university, and I have to say, first of all, that COVID-19, or actually SARS, what is it, SARS-CoV-2, the actual virus. This is one of the most puzzling diseases that we've seen for a long time. It's completely novel, even though coronaviruses are not new. There are other coronavirus diseases like SARS and the Middle East respiratory syndrome and even the common cold sometimes. This particular one has some features that are unlike any other. And this creates an even bigger challenge. So, of course, there are people working on vaccines, but there's all kinds of other important questions that have to be addressed. We don't know when or if a vaccine is going to work. And we also have to work on mitigating the effects of COVID-19 while we wait for the vaccine, understanding how it's spread, understanding how to prevent it. Prevention is always better than treatment for any disease. And we have some international leaders who've really taken this on. I mean, just to give some examples, we have the McGill Interdepartmental Initiative in Infection and Immunity, and you may have seen that on one of Derek's presentations with I think it was Marcel Baer who presented, and there's the Immunity Task Force that's led by Tim Evans and Catherine Hankins from McGill. There's the COVID Biobank Project led by our recent recruit Vincent Musser, and Martin Schmeng and Don Van Mile are two professors who put together an extremely original approach to diagnosing COVID-19 that's going to be moved out into the commercial sector. And they did that in record time. I mean, they started working on it in March and we're in June and they already have a company. And we're very grateful. First of all, we're very lucky to have these amazingly brilliant people. We're very fortunate to have a very strong community that supports us, alumni, benefactors, and so on, that make things possible. For instance, contributions to the MI4 Emergency COVID Fund. We're also fortunate to have, really, leaders who are able to attract the attention of the federal and provincial authorities to have confidence that McGill can be one of the key players in this struggle. Our people, of course, are plugged in internationally. I know that there's I'm not participating, but I know there's a Saturday morning phone call of all the people who are doing the kind of antibody screening that Tim Evans is doing, that several of my colleagues go on every morning to talk to people from around the world. There's a real worldwide search. This problem is so big that it requires, it isn't a one university problem. It isn't a one country problem. There's a lot of communication with China, with Italy, with France, with Britain, and other countries that have been struck by, with New York City, of course. And I'm really proud of the fantastic work that's been done by our leaders.
And so has it really put research into other diseases on pause for now? And when
yes.
could people get
so
back?
There's no question, just like
Yeah.
some aspects of clinical care have been on pause, some aspects of research have been on pause. And one of our challenges now is to figure out how to ramp that back up. It's not easy. It's easy to do we know how to do the research, but how do you do it when people can only be so many people per lab bench, or so many people can come into the office on a particular day? People have to be dressed in protective equipment. It's challenging.
So this is an important question that I'm feeling it myself in terms of having to go into the hospitals to get a checkup and staying away for now. So, there's so much talk about COVID, but the reality is there's so many other diseases for which people are affected by and may not be seeking care. I read, oftentimes in the paper to say, the ERs are worried about all of a sudden an influx of other patients coming, because right now it's all COVID, but what happens to everybody else? That there's heart disease, there's cancer, there's all other, injuries. So what impact will this have on the healthcare system?
Well, I don't know for sure, but I'm sure it's going to be difficult. I know in today's Gazette, for example, there was an article about making sure that people get flu shots this year. Not because flu shots will protect against COVID, it definitely won't, but we don't want some people to be in a flu pandemic and a COVID pandemic at the same time. That would be truly disastrous. I think it's unfortunate, the CHSLD experience where we had so many people here in Quebec die in chronic care facilities and nursing homes and so on. And it was exactly the same experience in New York City and in Italy and in Spain and in the UK. I think the healthcare systems, I said before about supply chains, how we get more efficient so that we can do things at the lowest cost and the most effective way. That works as long as the system isn't stressed. And I think, I hope that we'll rethink some parts of our healthcare system to take into account that we can't always use every last resource every day. If your emergency room is 100% full on a normal day, how is it going to handle a surge that happens with something is unpredictable? If your nursing home is built to just cost the least amount, well, all it takes is one sick patient and everybody in the nursing home is sick. If you don't provide personal protective equipment to nursing homes the way you do to hospitals, you've got a big problem. So I think we're at risk. What I'm hoping is people's experience in the first wave of this pandemic will have given us the hint that we need to think a bit differently, that efficiency is important, but we have to have resiliency in our systems as well. And resiliency means you can't always do things for the lowest possible price and the most expedient way. I think, I don't know if this will happen, but I'm hoping people will rethink their ways of doing things, including ourselves in terms of the way we organize education and take into account that things aren't always the way you think they're going to be.
So, based on all the challenges that you describe, so what's needed to really get to that next phase?
What do we need to do? What's needed is we need to think. It's always a hard thing to do. It's much easier to act.
Yeah.
We need to remember that we're all in this together. And, one of the things that I'm very privileged, I'm privileged in so many ways, but one of them is that I work in a learning organization. It's all about learning and discovering things. I think as a society, we need to learn from what's going on. I think we need to build on the strengths we have, as we do in the Faculty of Medicine. We try and build on our strengths of great students and great professors. We also are fortunate to have a great support from our alumni, benefactors, friends out there. I think that's a model in which the world has to look at that. The world is always a risk of people splitting off into their little tribes, but COVID-19 is a good demonstration of how that's pointless. The only way to tackle the really big questions facing us, whether it's COVID-19 or dementia in our population or climate change or any of those problems, is by working together and by taking advantage of our diversity and many different strengths to find the solutions that we need.
I'm hoping that, that McGill can play a really important role in terms of, everything that we are doing in our program is about education. And, when I came to see you a couple of years ago and wanting to change the healthcare system, I really believe that it begins in the classroom with the medical students and the way that the medical students prescribe information, support, education to family members. And, I'm seeing now what's happened in the long-term care centers and more people caring for loved ones at home. There really is an urgency to continue to educate family members. There's an urgency to educate healthcare professionals. I'm really hoping that over the coming months and year with our program, we can play a really strong role in educating the healthcare professionals, developing programs and, because all these people that are working in the long-term care facilities deserve to be properly trained, and if they're not properly trained, they can't do their jobs properly. And I think that that's a big role that, our program and the university can play.
I couldn't agree more. And I think this last experience emphasizes how although I, of course, think medical students are very important, it's not just medical students, it's all the health professionals, and they all have to work as a team in order for us to achieve the outcomes that we want.
So my last question is basically, so I was an ordinary citizen who knocked on your door with an idea,
Not so ordinary as all that.
Not as ordinary. No, my family tells me I'm not so ordinary. When I have an idea, I go for it. But I get a lot of people who write to me and reach out to me and say, how can I do what you're doing? How can I make a difference? Like, what can I do? So what would, I felt so honored to be with McGill because I didn't even have a university degree, right? I just had this idea. So what would you say to people that have ideas? It doesn't not only about dementia, but what would you say?
So I think the first thing is it helps to have a really good idea, which you had. And your good idea came in part because it came from your own personal lived experience. So you could speak about it in a way that most of us cannot. If that's one thing. So coming from the right place is important. I think it's important to also develop a sufficiently strong argument that you can get allies. We all need to develop what's sometimes called a winning coalition.
Yes.
In your case, I guess you're lucky because I thought this was really cool and we should do it. But I said at the beginning, and I will repeat it, I have a team, and my team also thought this was really important. They pushed hard to make sure that it happened. So I don't have the magic formula, but I think starting with a really great idea, being passionate about it, and especially if the idea is something that comes from the heart, I think that is helpful to communicate and to convince people that it's worth investing in that project. Okay, because that's something. I speak for myself. That's something that I look for when I'm trying to figure out, like, should I really spend time on this? If a person that comes to me the way you did, I'm much more likely to be engaged than if it's just off the cuff. Oh, wouldn't it be nice to do this? Well, no, you have to be ready to put some skin in the game. And I think when you do, you have a chance to really get people involved again. And they have to get Claire Webster to be a spokesperson, and it'll be fun.
Well, I have to tell you that I'm so incredibly grateful to you for taking the time today to let me interview you. This is kind of like was on my bucket list, even years ago. Yeah, it was. It was on my bucket list to say, like, years ago when back in 2011 on my road to recovery, I was like, I want to teach at McGill. I want to do something. And here I am interviewing the dean. So I'm extremely grateful for the time that you took today with all of us. And especially for me, this was great. I'd like to thank everybody for watching. Next week, we will be addressing the topic of responding to challenging behavior in persons with dementia with Dr. Don Dole. He is the geriatrician at the McGill University Health Center and assistant professor in the Faculty of Medicine. Just to let everybody know that this webcast is an initiative of the McGill Dementia Education Program, which is funded by private donations. So if you enjoy what you are seeing, please consider making a contribution to our program. And you can visit us at www.mcgill.ca/dementia. And until next week, take good care of yourselves, and thank you for tuning in.
Thank you very much for having me here.